Today I'll be talking about three common types of pain that we physios would be commonly encountering in a day-to-day basis. The first one is local pain. What is local pain? When the pathology is in a given structure, that pain will be confining around that structure is called as local pain. For example, in tennis elbow, the pain would be confining around the lateral epicondyle. In plantar fasciitis or the calcaneal spur related inflammation, the pain would be around the medial calcaneal tuberosity. In patellar tendinitis, since the pathology is local, the pain would be around the patellar tendon insertion point. These are all the examples of local pain. There is something called referred pain. Here, it will be confusing the therapist as well as the doctor. The pain source would be somewhere else and the exhibition point would be somewhere else. For example, in frozen shoulder, though the problem is in the capsule, the capsule through its C5, C6 nerve would be referring pain to the proximal to the mid-arm. Sometimes it can go till the elbow too. It depends upon their neural dermatomal pattern. Some frozen shoulders pain would be here, some frozen shoulders pain will be till the elbow. Nonetheless, the pain source would be the inflamed capsule in the shoulder joint, whereas the pain referring area would be over the mid-arm. Oftentimes physios would be treating the pain referral area thinking that the source of the pain is here. Even the patients would be loving the treatment to be done on the referral area because they think that's where the problem is. But it is going to more work on the counter irritant effect or to some extent the placebo effect, wherein the problem won't get solved. For a transient period of time, the pain can get mitigated because you are exploiting the pain gate mechanism, which is nothing but blocking the pain sensation by giving one more sensation in the form of heat or cold or massage. So this is an example of referred pain. Most of the low back pains or most of the discogenic pains do refer pain from one area to the other area. That's why some people will have pain in the paraspinal region, some people will have pain over the buttock region, for some the pain will be going to the groin area, but usually it will be coming from the spinal discogenic in origin. Such discogenic pains are the most commonest reason for neck pain and the back pain, but unfortunately we don't go by the source of the problem, we go by the locality of the symptom and then just treat the locality of the symptom. Sometimes it would work as the natural resolution takes over, sometimes it will get worse. That's when the patient thinks that the physiotherapy has failed them. This referred pain is a nemesis for the physios as well as the patient because nobody knows where the source is coming from. We always worry about the locality of the symptom and treat only the locality of the symptom, thinking it's a muscle tightness, thinking it's a fascia problem, thinking it's a joint stiffness and so on. The perfect answer for curing the referred pain is to treat the source of the pain so that the referred pain will anyway stop causing the pain. The third common form of pain is the radiating pain, otherwise called as neuropathic pain or neurogenic pain. In conditions like cervical radiculitis or radiculopathy, sciaticas, these are the classic examples of radicular pain where the pain will be felt along the course of the nerve. So that's why it's called as the radiating pain. The pain is the result of the proximal compression of the nerve which produces the pain along its course. The reason for the nerve compression would be 90% of the times the disc compressing the nerve rather than the nerve getting the pathology by itself. Its most commonest reason for such radicular or neuropathic pain is cervical and lumbar disc herniations or disc bulge, which will be compressing the exiting root, and that root produces the radiating pain. Again, the reason for such pain is the disc bulge itself compressing the nerve. The nerve is the victim, not the culprit. So if you want to cure such radiating pain, again you need to treat the source, which is the spine itself. So we need to try to do some form of spinal alignment correction exercises or decompression exercises or postural maintenance and correction exercises in order to prevent such compression of the nerves. So if you try to deal only with the locality of the pain, then you will be missing the diagnosis. Such given treatments would be no different from a massage therapy, which is more of a placebo type of treatment, right? So we physios as a healthcare provider must try to diagnose the source of the pain and treat the source. The locality of the pain and the pain characteristics will be looked after by itself. Apart from that, we have got other types of pain like inflammatory pain, ischemic pain, centrally generated pain. These are all the very smaller proportions of the pain. You don't really encounter that in your clinic much compared to the referred pain, radiating pain and local pain. Alright, I hope you learned something today. So let's start diagnosing the pain correctly and treat it accordingly. Alright, thank you.